when we are working with families who are in different stages of uh, deciding what the goals of care might be, what their wishes are for their child, one of the things we talk about often is once we learn what a good day is, we try to tell families at that point, you're the expert, you know your child better than us. And when you feel like you're no longer having good days, let's talk about ways that we can address that. Let's talk about ways that might better meet your wishes for your child so that you can feel like there's an opportunity for additional good days, but they may look different than the way that the good days used to look. And we recently had a conversation like that. And I think sometimes when families have chosen technology, in effort to honor up the baseline that they may have previously had, we kind of forget that it's okay to kind of revisit, or my nurse says off ramps, that sometimes families need permission for an off ramp. And sometimes in the hospital, I feel like families that are navigating a journey with complex illness, it's like, no, you chose this. You're going to get all the things because we have been with you to do all the things. Until we say that we have done enough, that is when we stop. I feel like sometimes that's how families feel. I feel like sometimes we forget that they're processing a lot of things, not just today's information. They're processing all the information. It's the last admission, this admission, the interventions now, the interventions there, who they had before, who they may be taking home. And just pausing just to say, um, this is where we are. This is where we're hoping for. This is what I'm worried about. And so I'm often able to say, this is a worry I have. I had this conversation just last week for a baby that is not responding to therapies. And I was able to say, we're all hoping that these interventions will work. We're trying to stop seizures for this baby. But I'm worried that these interventions may not. If these therapies don't work, are you going to be okay with intubation? Because the family had previously said no intubation. So, and a lot of times family have said, this is my line. And we try to remember where their line is. But I wanted to be able to circle back and say, how are you feeling today? How are you feeling about today's plan? If this plan is not consistent with your values, what would be? What are you wishing for now? And sometimes families will say, what I'm wishing for now is just to be able to hold my baby. What I'm wishing for now is no more blood draws, no more pokes. And they may not actually say, I want to change your DNR, but they may say, this is too much. And when somebody says this is too much, I think we have to ask, do you feel like we're having more bad days than good days? And we had a really sweet family about a month ago, and it just started with, this is too much. No, they don't want to, they always want blood cultures. We're not going to ask, they always want blood cultures, but they don't want blood cultures this time. And we need to kind of explore that because people have to be safe enough to talk about, I love my child. And today, love for my child does not look like you sticking them every day for blood cultures. And today, love for my child does not look like doing this procedure and giving people permission to do that. I think the hardest thing when we talk about no good days is for families where we're all hoping we can get their child back home one more time. I know for me, if somebody has said to me, I know we're in a different place than we were before, but I'm hoping we can get back home. I'm hoping that we will have more time at home, whatever that time looks like. I don't want it to be here. And then sometimes we're not able to get them home. And that is hard. And so, what does a good day look like in the setting of not being able to get home? What kind of control can I give them so that child can have good days? And maybe the control is minimal interruptions. Maybe the control is less labs. Maybe the control is relaxing the rules about family being here. Maybe the control is bringing in a big bed and saying, you know what? They will let us know when they need something. They don't need five teams coming in here asking the same history over. So we do often have to ask about good days and bad days. And I also made mistakes where I've predicted what a good day or a bad day was. And families have let me know that too. Even when you know a family really well, it can change from day to day. So it can be very humbling It's like, no, I know them really well. I know they would never choose that. I'm like, guess what, Terry? You were off. And they did choose.